All right, hey guys, what's up? It's Stephen Dunn with Core Therapy and Pilates. I'm gonna go ahead and take my mask off so it's a little easier for you to hear and see what's going on. But today I want to come on and talk a little bit about the jaw and the TMJ, another reason why I'm taking my mask off. One of the biggest complaints that I'm getting since we've been back reopened now for several months post shutting down is jaw pain as people are wearing headaches. As people are wearing masks, as people are wearing masks pretty consistently, pretty frequently now. And it's creating this situation where I've got my skeleton here. The mask is changing a little bit of the way we're holding our jaw and a little bit of the way we're having tension in our face and neck. So I wanted to go over that real quick and just kind of talk a little bit about what is the TMJ, what's the problem, and how we can go about making some improvements. So the TMJ here, as we look at the skeleton, the skull here, I got a full skeleton behind me. The T stands for temporal, the M stands for mandible, and J stands for joint, the temporomandibular joint. Temple is part of the skull, the mandible is the jaw, coming through here. And what happens when we talk, that joint moves right there. So that's the TMJ joint right there, or the TMJ joint becomes redundant. But there's that movement right there. Well, what I'm seeing with people that are wearing masks is they're doing this with their face a little bit. They're kind of opening their mouth and kind of doing this with their face muscles. And they're jutting their chin out a little bit forward. So that's just one of the things that I've, again, been seeing the last couple months. Well, what happens when you do that is you start getting some muscles that are inside your jaw, the medial and lateral pterygoids get really tight. On the out, those are muscles you can only get to inside of your mouth. On the outside, you have two muscles that you can get to. One's called the buccinator, I'm not sure if I'm saying that right, and one's the masseter. And then up through here, this big muscle up through here, when we clench our teeth, is the temporalis. So here, 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 and up inside are the main muscles that we are gonna find to be in tightness and imbalanced. And so we wanna go in and do a little bit of release work. So one of the first things a little tip I'm gonna give y'all is to take your knuckles, and if you open your mouth just very gently and go right in between the layers of your teeth and just give a little bit of pressure. For me, I'm wearing masks an hour at a time. Yesterday I had 7 people, so I was wearing a mask for 7 hours through the day. So by the end of the day, right through here is where I'm sore from talking and the way I'm positioning and holding my mask. Again, I showed you the mask here, but the mask that I'm wearing for the N95, when I put my mask on, the way that it creates a suction cup and the way that I end up talking for some time, right here, these muscles are tighter than they've ever been. So again, one of the ways you can help work on that on your own is digging in right through there. Teeth slightly open, mouth slightly open, I should say, not teeth, and just doing a little bit of pressure. So that's my tip today about the TMJ, because we're seeing lots of TMD, which is temporomandibular dysfunction going on right now. And I'm also seeing this very common with my back pain patients. So their low back is hurting, and now all of a sudden there's something hurting up in their jaw that's very new and a sudden thing that they're noticing with talking, chewing, opening their mouth to take a bite, those kind of things. So if you're having any trouble with any of that, reach out, let us know, 512-215-4227. We'd love to get you in and take a look at that and see if we can help you, because it is definitely something we've been working with for many, many years, but it's just a little bit of a spike in that incidence right now of the TMJ issue. So that's my message today, guys. Thanks for hopping on. You got any questions or comments, put them below, and we hope to see you soon around the studio. Bye now.